I'm Noscosi. So today I want to be demonstrating the mechanism of labor occipital positions. So we have like three outcomes of occipital position. We have anterior position, we have posterior position, then we have the occipital posterior position. So we have either the anterior, the posterior, or the occipito-posterior position. That is the OP position. The anterior position is when the occiput is pointing at the iliopetinal eminence. That is right here. It can be left or it can be right. While the posterior position is when the occiput is pointing at the sacroiliac joint. That is this dark line here. So it can be at the left sacroiliac joint or at the right sacroiliac joint. When it's OP, that's occipital position, is when the occiput is pointing directly at the sacral promontory. This position cannot be delivered. You need to deliver it through CS. So for today, we're looking at occipito-posterior position. That is the left occipito-posterior position. So with the occiput pointing at the right sacroiliac joint, like this. The lie is longitudinal. The attitude, complete flexion. The denominator is the occiput. The presentation is cephalic. The presenting part is left parietal bone. The engaging diameter is occipitofrontal diameter of 11.5 cm. With good uterine contraction, adequate maternal pelvis, and normal size baby, descent takes place with increased flexion, making the occiput the leading part. The occiput being the leading part means result of the pelvic floor muscle and rotates 3/8 of a circle to lie under the symphysis pubis, while the shoulders rotate 2/8 of a circle to lie at the right oblique diameter of the pelvis. With further contraction, the occiput escapes under the symphysis pubis and crowning takes place. The sinciput, the face, and the chin sweeps the perineum, and the head is borne by extension. With further contraction, the occiput rotates slightly towards the right side of the maternal pelvis to righten itself with the shoulder. The shoulders enters the maternal pelvic brim at the right oblique diameter, making this anterior shoulder the leading part. This anterior shoulder, being the leading part, means the size of the pelvic floor muscle and rotates 2/8 of a circle to lie under the symphysis pubis. With further contraction, the anterior shoulder escapes under the symphysis pubis, while the posterior shoulder sweeps the perineum, and the baby is born by movement of lateral flexion towards the mother's abdomen. So that is it for mechanism of labor, occipito-posterior position.